Dr. Kortsch is the Associate Chief Medical Information Officer and Associate Chief of AI and Digital Health at Denver Health, where he spearheads the integration of AI-driven solutions and cutting-edge informatics across clinical operations. With board certifications in clinical informatics and family medicine, he has led multiple initiatives to optimize healthcare delivery through advanced data analytics, machine learning applications, and digital innovation. His work includes pioneering projects that harness AI for predictive analytics, clinical decision support, and personalized patient care. As a recognized thought leader, Dr. Kortsch chairs the Cosmos Governing Council, the world's largest medical database, and contributes to state and national committees focused on advancing healthcare technology. Clinically, Dr. Kortsch cares for patients who are comprised of immigrants, refugees, and the medically underserved populations of Denver. He also shares his expertise as an associate professor at the University of Colorado School of Medicine, where he develops curricula and mentors the next generation of professionals. With that, Dr. Kortsch, go ahead and take it away.
Wonderful. Just a quick sound check. Sounds good?
Sounds great.
Great. Sounds good. Well, really nice. Thank you so much for saying those kind things, and happy to be here with you all today. As you know, I'll spend the next 50 minutes or so talking through frontiers in medicine. Lots of interesting things to talk about today. And we're going to talk a little bit about some core AI concepts, frontier capabilities, and then common risks and limitations. And I have no conflicts of interest. Personally think of that as my inability to plan ahead financially and actually invest in these companies. But other than that, I also have no other disclaimers. So without any further ado, let's start talking about AI. Today there's change. We all know this change is happening. Change happens over time. And in some instances, like political instances, it happens pretty slowly. Other instances, it actually starts happening quicker. So businesses can accept change faster. Outside of business, we see social change, and social change happens at a quicker rate. And yet, compared to all of these, technology advances at a rate that is entirely different than all these other change curves. Now, I'm going to come back to this change curve a couple times, but really today, throughout this entire presentation, I'm going to emphasize the rapid speed of technological progress and our need to constantly adapt and evolve and grow in who we are and who we train other people to be. I think this is necessary, and I think it's not just me. It turns out someone recently received a Nobel Prize for this same work. So really what we're starting to see more and more around the world is a recognition that technology is advancing at a pace that is faster than these other areas of society. So we need to find ways to keep up. One of the ways that we can see this remarkable change is through just some really interesting statistics. These statistics really point to all sorts of change that's happened in the last year. I'll point to this bottom left-hand side, really almost an eight times increase in enterprise use of ChatGPT. Really, people are starting to see the value of it. Furthermore, 60% of desk workers are starting to use AI, and a large percent of those are actually seeing it weekly. So outside of that, we're seeing growth in so many different areas, and that growth is really driving a huge amount of change. One of the important things with AI is for us to start talking using the right words and the right terminology. AI is confusing because people keep introducing new topics. So let's start with a couple base terminology, just so we get our feet under us. This is generative AI, and traditional AI. Traditional AI is the AI that we've been using in healthcare centers for the past decade or two. That's the machine learned algorithms. That's knowing if someone has sepsis or, has an algorithm that can interpret or help us interpret an EKG. Generative AI is different, right? It's creative. It creates content and ideas. It creates texts and image. That's often seen as narrow AI. Narrow AI is different because it comes in these different types. The way that I like to think of them is a range of deterministic on the far left-hand side and probabilistic on the far right-hand side. In other words, deterministic means you know what's going to happen, right? So if someone has a health maintenance topic, for instance, that they need a DEXA scan or a mammogram, you don't want a large amount of grayness in that. You really want to know they either need it or they don't. And so that's very deterministic. Risk scores, predictive models, and finally, things like ChatGPT are very different, and they're much more along the lines of probabilistic. In other words, if you ask ChatGPT or Grok or some of these other large language models, why did the chicken cross the road? Once a day for the next 10 days, you're going to get a different answer probably every single day. So that means that although we know kind of the directionality of it, we don't actually know what it's going to say. And so that really actually drives a big change for us and is really important for us to understand. Now, the way that that's used is in a lot of different areas, but that generative AI component and traditional AI component, both probabilistic and deterministic, really both feed into these concepts of agents or agentic AI. Now, agentic AI is different than generative or traditional AI. If you think of an agent is basically given, say, tasks and goals, and some sort of human or AI agent provides oversight into that. Then what's happened is on the back end, we feed it a system prompt and we feed it the ability to sense things. So sometimes it can sense the text or the image it creates. Sometimes it can log on to your social network site and post a post for you, or it can do all sorts of other things. But on the back end, we also provide memory tools and traits. And these types of things all come together to provide that agentic framework, which allows it to actually take action on what it senses in the environment. So as you can imagine, this is a very different structure than deterministic or probabilistic models that we've seen before, because it's starting to mix them to get an output that you can actually see and feel. And often agents are really the way that you interact with most AI these days. A lot of AI these days really has that feedback loop. We're moving away from strict LLM interfaces these days more and more. Did I lose anybody yet? Okay, so a couple other terms. I want to define artificial superintelligence and also artificial general intelligence. Now, you, you can read my disclaimer there at the bottom, which I had fun writing. But the reality is there's this concept of superintelligence, which is basically when AI systems are significantly above human beings, and general intelligence, which is a more murky topic, but often has to do with the speed of growth and learning. So, what does that mean for us now, these days, in AI? Well, over time, you can see that in this graph, you can see how AI has grown. So back in 2012, 2013, image classification was really confusing. It had a hard time telling the difference between a loaf of bread and a dog. But it's really good now. As a matter of fact, it's significantly above human performance, which is this line right here. In the last few years, we've seen more and more growth into understanding, mathematics, even PhD level in science questions. So I'm bringing this up now so that you can understand that artificial superintelligence is the capabilities of AI that are basically above that line or significantly above that line. And when we look to the future, artificial general intelligence is this growth. Now, we don't know when this growth is going to happen, but this growth is going to really predict this dramatic improvement of AI in its ability to learn. Looking at recent presentations given by all sorts of people, even most recently in Davos, Switzerland, people seem to be predicting that this is going to happen somewhere between 2 years, maybe 5 years, up to 10 years. But I haven't seen people predicting more than 10 years for a long time. So certainly within our lifetime and certainly within our career, we're going to start seeing not just superintelligence, which currently exists, but a moving into artificial general intelligence. So how do we interact with that? Well, there's this whole ecosystem of AI tech. At the base of it are these chips, and NVIDIA, AMD, and these other things make the chips. They're stored in the cloud. And then on top of that, there's these foundational models, things like Anthropic, OpenAI, ChatGPT, Mistral. That basically creates the brain of the LLM. And on top of that are sitting applications. And the applications that we're used to around AI come in all sorts of different forms. In healthcare, we often see these in three different buckets: clinical, business operations, and finally direct to consumer. Now, within those three areas, you really have to recognize these are broad strokes and some are more gray. But really starting on the far left-hand side, the clinical side, we're starting to see an increased growth in AI. I mean, that's why I'm here today giving this talk. But more than anything, we're seeing a big growth in business operations. AI is really being rapidly deployed across all sorts of different business operations, often faster than clinical. And then finally, we're seeing direct to consumer. Now, this direct to consumer is slightly different. And it's important to recognize that the clinical business operations are generally bucketed themselves into three different categories. And that means they're either coming from our EHR, often Epic, Cerner, MedTech, whatever you've purchased. We also have AI in software, right? So, spell check is a type of AI, but obviously, even using Zoom here to record this and transcribe it is using AI. And then finally, internally built, depending on how many models you've built within your own hospital or within your own garage, you can build these things. And so within those three buckets, there's a recognition that these are going to be deployed in an entirely different way, depending on how long you wait, right? So looking at this change curve, we expect clinical change to happen slower than business operations. And we actually expect direct to consumer to be the fastest area of growth in AI in the coming years. Now, as always, it's hard to truly understand how quickly these things will be adopted or they'll grow. But looking at data that already exists from ChatGPT, OpenAI, and the Kaiser Foundation, you can really see that already 1 in 6 US adults are already using chatbots. And over 5% of ChatGPT messages are already about healthcare. So this is not a small thing. And people are starting to recognize this more and more. And even JAMA, in their AI health and health report, this is a direct quote from them. They said, AI will disrupt every part of health and healthcare delivery in the coming years. And what they're doing in this report that they presented is really coming to recognize and helping all of us to understand how quickly technology is starting to develop and how quickly we need to start moving towards adoption. Many of you, if you're anything like me, are going to be a little cynical in a talk like this and be like, I think he's just hyped up about this, right? It's his job to think about AI. So he's, somewhere around the peak of inflated expectations. I don't know if you guys have seen this curve before, but I like this curve. In my mind, probably where we are right now might be somewhere around here. But the reality is, there is some hype going on. And there's some real concerns. And the concerns come from real problems that we haven't overcome yet. For instance, how can we avoid the societal biases that currently exist by training those out of the models, because we know the data already exists in it. We also know AI is prone to hallucinations. It makes stuff up. It doesn't always know the answer, and it acts like it does. Also, AI is really complicated. It turns out more and more enterprises aren't buying their own AI solutions, and they're actually buying it from a vendor. And then finally, even when you can get to a pilot, a large amount of these pilots never actually convert into like production environment where they're actually changing people's workflows. And then finally, people talking about the environmental impact more and more. And although using these AI tools often isn't as bad as making the AI tools, in other words, actually creating the foundational model, we recognize there is an environmental impact to all of this. So that was step one. How'd we do? So you guys still with me? Okay, so moving forward, let's talk a little bit about the implications of frontier AI and delve a little bit into academics here. As I said, I'm going to pull this graph a little bit more. And I know I've talked about how quickly change happens, but instead of thinking about all of this, I really just want to focus on technology in business, or what we're actually going to talk about is healthcare, because healthcare is a business. So let's talk about that. There's a lot of things you can learn from this curve, and I'm just going to pull out 3 lessons. And so let's talk about the first lesson here. And the first lesson you can learn from this curve is something called capability overhang. And this concept basically simply represents the difference between the frontier model, which is that teal color at the top, and the gray, which is probably your health system and all of our health systems around the nation. There's a big difference. And so that is our AI exposure. And exposure can also be seen as the concept of risk. And risk is, can be seen as maybe a competitive advantage. Maybe there's a component of AI that can replace our core business, but there's this exposure here as an organization we need to find ways to manage. The next concept I want to just introduce you to is this concept that we have to accelerate our adoption of technology. In other words, what worked, the change management that worked in the last year or 2 years ago or 10 years ago no longer works, and it has to change and it has to adapt faster. Otherwise, the frontier models are going to continue to change at a rate that we simply not just can't keep up with, but our risk is going to increase over time if we don't accelerate with them. So that's the second concept. And the third concept has to do with your organizational maturity. Many of you on the phone here aren't sure where your organizational maturity is, but there's all sorts of different ways that you can think about this. Probably many of you are right around middle tier, and maybe some of you are even at level 5, where you're leading AI governance, you're like driving industry leadership across the nation. But to be clear, we really encourage you not to be at the lower levels, 1s and 2s, but at least to really drive this organizational maturity. And the reason why is because if you look at this maturity, our AI exposure and our risk to those dramatic, innovative things that are going to come from AI increase, the farther behind we follow in organizational AI maturity. Okay. So I hope that makes sense, that basically if your organization is going to stay and say, hey, we're going to be a slow follower, not even a fast follower, we're not even going to try to be innovative, we're just going to slowly follow behind, your risk is going to be much higher than the organizations that say we're going to be a fast follower. Or the last organization, which is going to say, the Mayos and Harvards are going to be like, hey, we want to be innovative across the nation, across the world. So overall, 3 concepts. Let's just review them really quick, that there's something called this AI exposure, this risk. You need to manage it by maintaining not just your current rate of acceleration, but actually increasing your rate of acceleration to align with the acceleration that's being seen in the tech sector. And then finally, our organizational maturity really drives that risk overall. So that's about as technical as I'm going to get here. But I think it's really important for us to think about this, because what I'm telling you isn't just academic, it's actually starting to see in real world. This is a graph that's coming from this group called Epoch AI. They're kind of bearish on AI, but they have this trending line, which is really interesting. And it shows that the growth of AI is not linear. And what we're starting to see more and more is an increase in the rate of growth that really aligns with those technological curves that I've been showing you, and the technological capacity, which I showed you at the beginning, where AI now can tell the difference between a dog and a loaf of bread. And these types of growth capabilities of AI is actually happening faster and faster. And it's not just you thinking you're falling behind, it's the entire world thinking they're falling behind, because technology is adapting so quickly these days. So what does this have to do with medicine? Turns out a lot. Many of these tech companies are starting to create these groups and starting to announce them to the world. Microsoft AI put together this group called the Path to Medical Superintelligence. And when we talk about medical superintelligence, that's not like me interpreting what they're saying. This is actually the title of the group, Medical Superintelligence. And what they did was they put together this AI, kind of 5 AI agents, and they talked to each other to try and answer medical questions. And then on the back end, they do a cost analysis to how well AI is doing. And in this paper, I thought it was really interesting, because most people say, hey, yeah, AI can do a lot of things, but does it really know what to do with these medical issues? This study really showed that most doctors are accurate about 20% of the time in the New England Journal of Medicine case proceedings. And for them to be accurate 40% of the time, they actually are charging the patient in the healthcare system about $3,000 to get that diagnosis. Now, this compares to these other AI models that, as you can see, with $3,000 can almost get 80% accuracy on these New England Journal of Medicine case proceedings. So really that acceleration that I've been talking about and that growth isn't happening just in knowledge, but it's starting to become more and more in the application of knowledge as you've moved forward. We're also seeing this in really interesting publications. Over the last year, these are just publications I pulled in 2025, you can see there's just been a growth in all sorts of publications that are really consistently showing how AI can be used to improve, physician diagnostic accuracy, or how they can help them using a chatbot in urgent care, or detect breast cancers or interpret PFTs. So there's all sorts of different ways that AI can be applied in medicine, and it really drives a large improvement much of the time. Now, the reality is, we're starting to learn more and more about when it doesn't, okay? And this concept is often called fragility, and AI is fragile, okay? The New England Journal of Medicine example that I showed just 2 minutes ago really pointed to a very clear and structured way that they presented the data, and they didn't try and trick the AI in any way. The thing is, it's so easy to trick the AI. It turns out you can do all sorts of really very simple things, and the AI becomes tricked and really loses that accuracy. For instance, like, images, for instance, you can add images or subtract images, and it totally messes it up. You can change formatting and it messes up AI. So there's just all sorts of things you can do to AI. And if your data isn't structured in a perfect way, it really comes up with inaccurate responses. So what people are recognizing, it's not just that it's super intelligent, but it's super intelligent and slightly fragile in a variety of ways that we as our brains function information just aren't, and really working hard to find ways to improve that. So that was Frontier AI. How are we doing? Okay. So, I know Frontier AI is easy to talk about, and it's easy to make fun of the CEOs that, are looking for another $100 billion in funding to build these huge data centers and move forward with their plans to create these models. But what does it actually mean to health systems, and what does it mean to us on a day-to-day basis? And so let's talk through a little bit of what tools exist and kind of a little bit more background into that. One of the ways that we know that AI is being used in healthcare is because of surveys like this. This is a survey I did about 8 months ago, and I asked our managers across the organization here at Denver Health to anonymously, by the way, 100% anonymous, I worked hard to make this anonymous, and said, how many of you guys are using personal AI in the organization, and it's AI that we didn't purchase for you? And it turns out about 75% of the leaders in the organization are using AI like ChatGPT, which you could see is the most common one, in their personal productivity. As a matter of fact, just in the past few weeks, I met with an executive who turned to me and said, we were one-on-one, by the way. He said, I do not know how I can do my job without AI these days. I don't know how people are doing this. So if you are not one of these people who are using AI, your peers are, and this is a good thing to talk about. Here at Denver Health, we apply AI in all sorts of different ways. This is a very busy graph, okay? But let me just show you what it means, and then hopefully this is helpful here. Think of these as two axes, so the clinical axis versus operational axis, patient-facing axis versus staff-facing. So what I work to do is graph all of these in a way that you guys can understand where we're applying our AI, because this purple color is generative AI. The gray color is predictive analytics like sepsis and ICU mortality. We're developing stuff internally, and we even have robots. Okay. So what you can see is a really interesting thing that most of the AI we're deploying in our organization is down in the bottom right-hand side. It's operational, staff facing, it's not clinical, and it's definitely not patient facing. We're very careful about patient facing AI. We want to make sure that we're creating content that's trustworthy. So a couple different things here. First off, about 80% of our AI tools is in the bottom right-hand side. And that's because within that staff-facing operational, we can predict the largest return on investment. You know, these things take money to implement, and they're often the easier implementations as well. Next. You know, AI, when it's used clinically right now, is rarely generative AI. It's actually much more likely to be machine learned algorithms that are predicting risk scores and things like that. Don't get me wrong, there's a decent amount of generative AI, and we're rolling out more and more. I mean, even in the next 3 weeks, we're going to roll out multiple new tools, but the reality is most of these aren't. Next, we have a real mixed ecosystem, okay? The word ecosystem is a little strange in this case, but the reality is there's a lot of diversity there in how we're doing AI, and it's actually making governance challenging because we have to be really careful how we deploy these tools. Next, patient AI is really sensitive, which I brought, is very conservative, sorry, because we're very sensitive about applying tools only when they're trustworthy. And finally, we're actually doing a decent amount of internal infrastructure development. I'm going to have to pull these out of this and actually start listing these because we have a large number of research and internal development projects that are currently in the works to drive value to our organization when they're doing repetitive tasks or finding ways to move forward very quickly in areas that often are hard or data heavy. As an example, we have a tool called DHGPT. It's kind of like ChatGPT, but we call it DHGPT. It's an open source, HIPAA compliant, on premises. In other words, it's our servers, our hardware running an open source model. And so we're running an AI model that's very secure. And our staff can simply use it if they want to. Now, don't get me wrong, they don't have to. There's nobody here telling them that they should move forward with this. And there's certainly nobody even encouraging them. Interestingly enough, what we saw was almost 1,000 users in the first 3 months with like almost no education on this, okay? So really a shocking number of users across the organization really desiring to use AI tools to improve themselves and improve their productivity. The reason why I really wanted to emphasize that is because this is not a toy, right? We're not using DHGPT to make silly images of cats and baboons. We're really using it to drive value. And I can't emphasize that enough because we know that DHGPT and these ChatGPT equivalents really do improve people's output, specifically around knowledge work. Much of the work that you and I do on a day-to-day basis is about knowledge, and it does improve how we do that. It saves us time, okay? And it turns out that if you haven't used AI in the last 6 months, chances are it's at least 4% better, probably significant more than that. And that's just in the last 6 months, because we're seeing about an 8% improvement each year in the ability of the model to completely complete the task that you ask it to do. So real growth here and real ability to continue to see value at the organizational level with a return on investment that's real. It's not just that. There is a reality that there is a natural level of inequality in AI. For instance, myself, I have $20 to spare on my monthly subscription to ChatGPT, okay? And so I can spend that 20 bucks, okay? But not everybody in our organization can. And it's really vital that we support everybody in the organization. And that inequality that naturally happens, we're hoping to reduce by providing tools like DHGPT that allows them to see the benefit of AI in ways that maybe they couldn't afford if they didn't have that, that $20 a month or other types of subscriptions. So what are we rolling out? Well, you know, within Epic, we're rolling out a large number of tools. We've seen this is going up by about 1,000 unique users per month. So we're up to 1,000 at this point in the last 3 or 4 weeks, and really seeing a value in Epic's approach to this, as we are able to roll out and deploy tools that have been validated in other organizations, and then we revalue them at Denver Health. So let's give some examples here. Epic Insights, for instance, is something that provides a summary of tools. That summary of tools, summary of clinical notes and so forth, allows the clinician to simply read in line a summary of where the patient's been since they saw them last, or maybe just in the last 3 years. So we've been piloting this for the last few months and are going live in the next few weeks, 2 weeks or something like that, for all our users to be able to start using this. And this is both on the inpatient and outpatient side, really driving a reduced need to kind of review medical records. We also have tools like the text assistant. You highlight it and you can summarize the text or rebuild the text in a way that's applicable in different situations. We also have the in-bask assistant. It's basically a tool that takes what is known of the patient, things like what medications they're on and what problems they have, so that when a MyChart or a patient message arrives in our organization, we're able to look in the context of all that information and draft a reply. Our providers then have the ability to start with that draft or start with a blank reply. Either way, they have the ability to kind of reduce the amount of effort it takes them to move forward with writing these messages. We also have tools that are coming in from Cosmos. I've been involved in Cosmos pretty heavily over the last few years, but Cosmos is a really interesting data set of over 300 million patients. If you haven't heard of Cosmos and you're on Epic, you should really talk to people about it because it's pretty dramatic. For instance, this is a screenshot of one of the ways that you can see diabetic neuropathy is remarkably different if the patient is on insulin versus metformin. So as you're talking to the patient and they express concerns about their family history of neuropathy, everybody who has diabetes, you can say, hey, if I start you on metformin as compared to insulin, the risk of these diabetic neuropathy and side effects are significantly lower in certain medications. So there's a lot of benefit here. We're starting to see increased use in this and are rolling this out much more widely in the next few weeks. We also are live with an ambient AI solution. It's nearly impossible to talk about AI these days without talking about the ambient AI, I'm going to call it revolution in charting in healthcare. The reason why this is so important is because our ambient AI in general, in our solution, Nabla, has really dramatically changed the lives of our staff. We've done evaluations pre-post and have seen that when providers use and start to use these ambient AI solutions, which write their notes for them, we see a reduction in burnout and improved in engagement, and we're working hard to validate whether or not there's a change in patient satisfaction as well. That being said, ambient AI is the gold standard in AI deployments across healthcare systems right now. If you guys are not live with an ambient AI solution, I'd really encourage you guys to look into them. They are pricey, but they have a large value, and the value is consistent. When we've trended the impact of ambient AI solutions over time, we've seen that the benefits you see in the first few weeks are persistent across 60, 90 days even. So when we interview our providers about the changes that they've seen in the EHR and how they want to move forward, really without a doubt, one of the biggest points of feedback that we've seen in the last year and a half since we've deployed ambient AI is really the value of this in provider workflows. Ambient AI is also multilingual, which is really wonderful for many of us who speak other languages. And so Spanish, French, Russian, Vietnamese. It does a great job in many of these languages and really has the ability to you to have the interaction with the patient naturally and then make your note in English. We've also been working hard to roll it out to places outside of simply our family medicine department. Obviously, we've rolled it out widely across the organization, as you can see by a number of encounters and users, which, by the way, keeps going up every month. So let's talk a little bit about regulations and then how to move forward from here. You know, regulations come in a lot of different ways. The FDA has regulations. They have some really interesting things that came out in December with new licensing requirements for AI tools. There's new billing codes, and we're soon starting to see the direct-to-consumer AI products are going to be sold under the CMS access and tempo regulations. So really interesting things coming out of the federal side. We also have state regulations. You know, we're in Colorado, and so we're unique. We have some really interesting regulations that we're working to modify, but still those regulations really drive a large amount of work for us as an organization so that we have to maintain all sorts of programs to keep the quality high. But we also have, you know, things like Joint Commission, other types of industry standards, and finally professional standards, as you guys all know, around the use of AI. And we're having to maintain these moving forward. So there really is some work behind the scenes that needs to happen at the organizational level to keep AI effective and in compliance with all the regulations. However, we know that people only use it when peers and leaders support it and model it. It turns out that although you can speak about regulations and speak about the challenges that has, you know, adoption of AI across the board is really has really been shown to have a large amount of good outcomes, and the ability to foster trust and encourage experimentation is vital in our conversations with trainees and other people in our departments to kind of continue to allow them to benefit as we ourselves have benefited from some of these technologies. One of the most common technologies that people use is these base AI models. The next 8 slides or so are just going to be some examples of some tools that you can start using. I started with these base models because these are the ones that most people are using. Things like ChatGPT, Copilot, Gemini, and so forth. You know, they run, I said before, they're $20 a month, but you can get free $8 or even up to $200 a month paying for these things. You can also see that ChatGPT is getting slightly less popular, Gemini slightly more popular. All that to say is there's a lot of good options out there, and they don't have to cost money. A decent amount of them are free. But that's not the only thing that matters. It turns out that these models that come in all sorts of shapes and sizes. Some of these, like the ones in Hugging Face and so forth, and Maestro, are actually open source, and you can download them and use them on your own computer. So if you don't want to use it online, just download it on your computer, and they work great there too. You know, there's all sorts of different tools that we can use, and open evidence is one of the tools that we can use that does a really good job of combining evidence. If you haven't used it, I would encourage you to get under that rock that you might be in, because I think this is the most widely used AI product by physicians across the nation right now. It provides a really good summary of evidence, and then you can see at the bottom here, it gives you the citations so you can look it up yourself. I'd really encourage this. This does a really great job. It's actually free right now. They've started to do advertisements, so you have to blow through a couple drug advertisements to get it, but it does a great job. Doximity is another free tool, and it is a really interesting GPT kind of HIPAA compliant tool that you can ask questions to, and it does a really good job. Doximity, you know, is known to sell their data to a lot of different people, and so that's why this one's free. So heads up there, you guys can make that decision to use it or not. There are all sorts of other tools. Elicit, for instance, does a great job in writing papers and actually finding relevant papers relative to the topic that you're interested in. And I know I've seen many lecturers go up and, they, they give talks about AI and they complain bitterly about, hey, AI can't even make a bibliography. Well, unfortunately, that's old news. AI can make a great bibliography these days, and Elicit's one of the ways that we can do that. Visual diagnosis is another one. You have to pay for this unless you have a site license, and you basically take a picture of the dermatologic condition. It does a really good job of helping you diagnose these things. Outside of that, there's a decent amount of other tools in visual diagnosis, but it actually is really well respected and does quite a good job. AMBOSS is an interesting and growing area of medical knowledge. AMBOSS does a really good job of summarizing clinical content, and it's well known from some of our residents to help with education. So both teaching, board reviews, and so forth, lookups. It does a surprisingly good job. It also cites the evidence, so you can look it up yourself. Consensus is another way. You can look up evidence, kind of like that bibliography search, but kind of slightly from a different angle. And you can ask it questions. It'll do a really interesting evaluation for you, and then provide citations that you can follow up on and look at. And it does, like I said, all of these are really AI first products, and they do a really surprisingly good job. Cite AI, another one. This is basically, it thinks of itself as a research assistant where it basically does the research for you and helps you understand where to go from here in your questions and what to read. So take a look at that one too if you're interested in looking through these things. Glass AI is a little bit more enterprise level, but has some really interesting structured data format that helps you out with, differential diagnoses and treatment planning and so forth. So our residents have certainly been using that and in finding ways to really improve their treatment plans and feel confident in their knowledge. So I've talked a lot. I think this is the last slide, and I just want to end with three quick quotes. That first quote that I started with is really just the reality that AI is going to disrupt every part, or it's certainly a large part of health and healthcare delivery in the coming years. And that's just not me. That's coming from JAMA. I also want to quote from Dr. Harari, who had this really interesting quote in a recent lecture he gave, saying anything made of words will be taken over by AI. And really, we need to recognize moving forward that AI's ability to generate content is remarkable, and it's only going to accelerate. Finally, good old Stephen Hawking gave us this great quote that intelligence is the ability to adapt to change. And so I really challenge you guys, both on a personal level within your own practices and as you teach other people, to really find ways to integrate AI appropriately into the practices to improve your life and the lives of your patients. So now, if there's any questions.
Can you hear me?
Yeah.
Yes.
It's Lynn Jones from CAFMER. Thank you so much for this today. I'm hoping that the recording will be well attended. But I'm just curious, you named a lot of tools. Are there some that you rolled out at Denver Health specifically with learners and teachers in mind that were especially helpful?
Yeah, probably the ambient AI is the most valuable tool. We've worked hard to start rolling that out in appropriate ways to make sure that we're supporting people wherever they stand in their learning. So within the sphere of learners, interns all the way up to people who are about to graduate really need different levels of support when they're writing their notes. But as their work requirements increase and they have to see more and more patients, they're getting more and more crunched for time. And giving them an ambient AI tool has really driven a large amount of satisfaction from them in their HPI specifically. We've also tried to allow them to use it in other areas, but the HPI is really, they've been saying high value. So don't get me wrong, a lot of other ways that it can be applied in all sorts of things, but that's probably the easiest and the most widely applied across the nation.
Thanks. And what about what kind of advice would you give the teachers in terms of working with residents around AI and the whole ethics and professionalism? And I know you didn't roll all this out to your institution immediately. So what cautions do you have for actually, you know, even recommendations for teachers?
Yeah, I think we all are in, we're all in the same sphere right now, needing to learn rapidly. You know, I often that conversation you have with residents and with learners often is hierarchical, where you're teaching them content, and in AI and in the tools that allow us to effectively get information and, you know, use that information in clinical context, is our residents are starting to learn those tools equally as fast and sometimes faster than some of us are. And so I think, to answer your question, I would suggest approaching conversations around AI with learners very open and recognizing that we need to learn from each other is vital. We can't simply suppose that all AI is bad. We really have to open the conversation with, I noticed you used ChatGPT. Tell me, let's talk a little bit about this. You know, each organization is going to have a different policy and different security format and other things to keep data safe and to make sure that the AI tools are being used in appropriate ways. But starting that conversation with the recognition that many of our learners are using AI in all sorts of ways is probably the most important thing. Did I answer your question? I think what I didn't say was all the risks associated with AI, but there's a lot of risks associated with AI.
Yeah,
which is a whole nother lecture in and of itself.
And you must have.
I think all of this, you know, makes me think of, you know, applying this to smaller residency programs. We have a lot of rural residencies and rural clinics, rural FQHCs, you know, that don't have, you know, the funds to like maybe support something organizational wide, but, you know, just these few options for the individual, I think are super helpful. And also, you know, you had mentioned, how AI can affect the workflow and like positively and reduce the burnout, physician burnout. I think those are definitely like tangible like outcomes that we could all use and look forward to applying these.
Yeah, love it. It's definitely the gold standard. If we can reduce the burnout and help them just have a better interaction with their patient and provide better care, I think those types of things are so vital. So as much as possible, we need to emphasize on that.
Thank you so much. I think we'll go ahead and close. And thank you so much for your wonderful information. And
Thanks, Dr. Kortsch. Appreciate you being here.
Definitely. You guys have a great day.